Hello friends, I'm super excited to welcome you back to my YouTube channel. Please, if you are new to my channel, support me by clicking on the subscription button. God bless you. In this video, we'll be talking about aneurysms. If I may ask, what do you understand by aneurysms? Probably this could be the very first time you're hearing the word, but do not worry, I'm here to guide you through so that you know what it's all about. We are in this together, okay? So there's nothing to worry about, alright? Aneurysm is simply a localized abnormal dilation of arterial wall. It could also be a dilation of the wall of the heart. Let's not forget that the wall of the heart is made up of three layers, which includes the endocardium, also known as the innermost layer of the heart, the myocardium, which is made up of cardiac muscle. And do not forget that this cardiac muscle is an involuntary striated muscle, which is responsible for the contraction of the heart. The last layer is the epicardium, and the epicardium is simply the outermost layer of the heart, formed by the visceral layer of pericardium. Before we digress, it is important we note the common places where these aneurysms can be found. They can be found in the thoracic aorta, the intracranial arteries, and the abdominal aorta. Aneurysms may also be seen on the femoral arteries, the splenic arteries as well, and we know the function of the splenic arteries, which is simply to supply the spleen with oxygenated blood. The splenic artery is also known as the linear artery. Alright, so aneurysms may also be seen in the popliteal artery. I believe we can still remember our popliteal fossa and its boundaries. But if you don't remember, don't worry, I will still make a video on the popliteal fossa to refreshen our memories. Alright. Aneurysms can also be seen on the renal arteries as well as the carotid arteries. A patient might have aneurysm without showing any symptoms of it at all. That is to say, the patient is asymptomatic. Or it may cause different symptoms depending on the location of the aneurysm and also on the size of the aneurysms. I would have loved to show live image of aneurysms, but due to YouTube restrictions and regulations, I won't be able to do that because I would love this video to reach to all age brackets, alright? I pray you understand, alright? It is important that we know that aneurysm can be classified into two types. They can be classified into true or false aneurysms. The true aneurysms involve all layers of the artery, and we were made to understand in the histology of the cardiovascular system that arteries comprises of three layers, which includes the inner endothelium, which can also be called the intima, the middle muscular layer, which is known as the media, and the outer connective tissue layer, known as the adventitia. True aneurysm happens when the dilations are bounded to the arterial wall, or it can be on the weakened wall of the heart. I hope you still remember the walls of the heart, not the ceilings of the heart. A typical example of true aneurysm is congenital vascular aneurysms and also left ventricular aneurysm that is seen after myocardial infarction. As for false aneurysm, they occur when a blood vessel wall is injured and the leaking blood collects in the surrounding tissues. False aneurysms are also known as what? Let me see if you can guess what false aneurysm is also called. False aneurysm is also called pseudoaneurysm, alright? Examples are the post-myocardial infarction rupture that has been contained by pericardial adhesion, and also leak at the anastomosis of vascular graft with natural artery. I hope you still know what anastomosis is all about. Hope you've not forgotten your anatomy where we talk about anastomosis. Alright, so anastomosis is simply a junction or connection of blood vessels. Okay, so I want you to still remember and recollect what anastomosis is. It's just a junction or connection of blood vessels. Aneurysm can also be classified based on the variety of disorders that weaken the wall of the blood vessel. They include the traumatic aneurysm, which is also called the arteriovenous aneurysms. Another one is the berry aneurysm, which is as a result of congenital defects. Congenital defects, as we know, are those disease conditions or clinical conditions that arise during developmental process of embryo. If I may ask, do you still remember the difference between embryo and fetus? Let me see if you can be able to guess. The term embryo and fetus both refer to the developing baby inside the mother's womb. Why am I talking like a layman? Please, uterus, okay? The difference between embryo and fetus is based on gestational age. An embryo is the early stage of human development in which organs and critical body structures are formed, while a fetus is a developing baby beginning in the 11th week of pregnancy. Let's not digress, okay? Let's not digress. Let's get back to what we were talking about on aneurysm. So the berry aneurysms are small and spherical dilations. They are seen mostly in the brains, okay? That's where you see the berry aneurysms. The next aneurysm is the mycotic aneurysm, and these aneurysms are largely due to infections. Another form of classification of aneurysms are the classification due to descriptive purposes, in which aneurysm can be classified by the macroscopic shape and size of aneurysms. In this classification, there are two major types: the circular aneurysm and the fusiform aneurysms. The circular aneurysms are spherical in shape and their sizes ranges from 5 to 20 cm in diameter. These aneurysms are often with blood clots completely or partially. Okay? As for the fusiform aneurysm, they normally look like narrow cylinder involving a long segment. They have a varying diameter of about 20 cm and also a varying length as well. From our discussion so far, we've been able to understand what aneurysm is and the possible classification of aneurysms. Now, what are the causes of aneurysm that we've been talking about? Most of the common cause is the weakening of the arterial wall. The weakening of the arterial wall is associated with atherosclerosis. And atherosclerosis is a disease of the arteries that is characterized by the deposition of fatty material on the inner walls of the artery. Alright? Some of other causes of aneurysms are trauma, inflammation of the blood vessels, which causes changes in the blood vessels wall. And this inflammation is known as vasculitis. Cystic medial necrosis and post-surgical anastomotic disruption can also cause aneurysms. Rarely, syphilis and localized bacterial or fungal infections, which are caused by sepsis and infective endocarditis, weakens the arterial wall and cause infected aneurysms. This infected aneurysm is also called mycotic aneurysms. What are the things that can increase the chances of aneurysms? Firstly is smoking. The use of tobacco is the strongest risk factor of aneurysm. Other factors are obesity, hypertension, too much intake of alcohol, old age, especially people between the age bracket of 70 to 80 years old. Also, individual that is copper deficient is also likely to have aneurysm. Also, individual from a family whose member of that family have suffered aneurysm can also suffer aneurysm as well. In our next video, we'll talk about the pathogenesis of abdominal aortic aneurysm. Thank you so much for watching. God bless you. God got you. Peace.